This is Dr. Aida Wen, geriatrician with the Department of Geriatric Medicine at JAPSOM. Thank you for joining us for the ECHO, Long-Term Services and Supports, our special COVID preparation series. A special thanks to our collaborators, who include the Hawaii Emergency Management Agency, Healthcare Association of Hawaii, Hawaii Association of Directors of Nursing, Hawaii Medical Directors Association, and the Mountain Pacific Quality Health. We usually have a brief presentation, then we open it up for time for questions and discussions up to 3 p.m. And we ask you to use the chat box to submit and queue up your questions. Next slide. This is the schedule for upcoming sessions. Just take a note that on Monday we have Memorial Day holiday. So please take a break and take time to take care of yourself, relax, enjoy. And on May 27th, we will have Daniel Hamowitz and Josh Allen back again to talk about COVID challenges and opportunities in assisted living. And I'm sure there's going to be lots of questions with that. And then on June the 3rd, we'll have Caitlin Cook from the Department of Health talking about COVID tracking logs and checklists, more things that we are required to do, and things that will help us keep track of the things we need to submit. Okay, at this time, we ask you to enter your name into the chat box for attendance purposes. And for those of you, let's see, calling on the phone, if you can unmute yourself and tell us your name, we can write that down. Let's see if there's anybody who is on the phone. There are a couple people on the phone. Do you want to unmute yourself? I'll give you a sec. Don't be shy. People are too shy. Okay, anyway, so today our topic is NHSN COVID-19 reporting updates. And we have Mark Marabella from Mountain Pacific Quality Health, who will be speaking with us. And then following that, we'll have Tom Vincent, who's a data analyst for Mountain Pacific Quality Health. And following him will be Maggie Oki, also from Mountain Pacific, and who are really helping all of our facilities come up to speed with this requirement. Okay, so without further ado, oh, actually, you know, I didn't tell you about, sorry. Anyway, I didn't tell you about the CMEs, but there are CMEs for this. You need to register online on our website, and we actually have that link on our chat box as well, and you have to complete an evaluation. And once you do that, then we can provide you CMEs for that. Okay, now I'm gonna let Mark take it away. Thank you.
Oh, thank you very much, Aida. Aloha and good afternoon, everyone. It is a privilege and an honor to be part of the GWEP COVID-19 Echo series, and in particular working with you, Aida, Michaela, and John. As we mentioned, NHSN COVID-19 reporting updates is our topic today. Our team will discuss reporting into that module with you, so we want to make sure it's a discussion, that we're all part of it. Just like many of you, we also receive our marching orders from CMS. We are a technical support team. To maximize the effectiveness of this participation and presentation, we encourage everybody to participate. The more interactive, the better. Reporting successfully is a collaboration of a technical and clinical approach. We'll go over the technical processes during the first part of the program, and during the discussions that follow, we would like those of you who have reported successfully into the COVID-19 module to share your perspectives and successes, your tips and tricks. Let's make this an all teach, all learn opportunity. Next slide, John. The Hawaii team here, the nursing home team, is regional. And by that I mean Maggie Oki, who obviously needs no introduction for most of you folks, has for over a decade been the clinical anchor for our Hawaii team. Mary Argones handles the day-to-day operations. You see her name on all the emails, reminders, updates, resources, and tools that come from everywhere from the Department of Health and CDC to Mountain Pacific and CMS. Our speaker today is Tom Vincent, and he's a data analyst, and he works out of our Montana office. So before we get started, we'd like to have the first poll up if we could. Okay. Have you been able to report COVID-19 into the NHSN module? Yes or no? And number two, how many of you are awaiting SAM's authorization or access to NHSN? We'll give you a few minutes here to enter that information. And do we have any results yet? Okay, 25% say yes, 8% say no, and 67% not applicable. How many of you are awaiting SAM's? That's a great, that seems like a very low number. So happy to see that. That's
really good.
Yeah, that's exciting. Okay, next slide, please, John. All right, so our discussion today will cover the following: enrollment, touring the CDC website and instructions and regulations that Maggie will take on, followed by an open forum for discussion. So I'd like at this time to introduce our data analyst, Tom Vincent. And Tom, you'll need to share your screen.
Yeah, let me get into there. Good afternoon, everybody. It's a pleasure to talk with you today regarding NHSN. As Mark said, I work as a data analyst with Mountain Pacific Quality Health. I'm located in our Montana office here in Helen, Montana. I'm also the NHSN facility administrator for Mountain Pacific Quality Health. So I have, over the years, spent some time out in the NHSN, what I like to call a database. Today I'm going to just go over a brief overview of the enrollment process into the COVID module in NHSN. I know from the looks of the numbers, most of you have had success in enrolling, so this will be a little bit of a repeat for you. Afterwards, we'll talk about some different ways to enter data into the module, and then I'm going to go ahead and log on just so everybody can get a look at what the module looks like and see firsthand maybe a little bit on how to enter your data. So what I have on the screen right now is where pretty much all the resources for the module are on this website. This is at the CDC in the NHSN, National Healthcare Safety Network, the long-term care, and of course, the hot topic, the COVID-19 module. I'm going to start, I'm just going to scroll down. This is a very useful website, and I will be referring back to it a couple times as I speak. I'm going to start with the enrollment document. And for most of you, you have seen this, and as I alluded to earlier, you've completed it. A couple caveats that I would like to, before I start though, for those of you who have had issues enrolling, the one thing we found was that if you have already enrolled, or if you have already started the enrollment process and have run into difficulties, please do not re-enroll. Don't try to re-enroll. That makes a sticky mess that will take some time for NHSN to clean up for you. And I want to be specific also, this is not the enrollment process to gain access for the entire NHSN system. This is only for the COVID-19 module. The other requires a little bit higher security check and takes literally weeks. Even when we're not in a rush to get in there and get enrolled, it takes weeks to be approved and receive a grid card sometimes. So just getting started, the first thing that your facility is going to do is select who is going to be the facility administrator. Maybe you volunteered, maybe you got volunteered. This is the person that will be logging into NHSN, will have access to enter the data for the module. Once that person is selected, this is a 4-step process. The first step is to make sure your computer is prepared. Check with IT, make sure you have the right web browsers, etc. Also make sure your email is set up to accept messages from NHSN and SAMS. SAMS is the security side of this process. They set up your username and password, etc., and do the background check. Once you've done that, you're set to begin the process. And the first thing you do is register with NHSN. This is basically a 1-page form, just letting NHSN know that you need to get into the system so that you can enter your data. Just a couple notes on this form is there's a drop down for the facility type, your facility type. Please use the description that has the COVID-19 in the description as it is highlighted here. So now you've alerted NHSN that you want to be in there, and you will receive 2 emails. You'll receive one from NHSN. It's kind of a welcome to NHSN email. The second is from SAMS. SAMS is, again, the Security Access Management Services. I've heard through the grapevine that several people, well, not several, it sounds like quite a few, were not receiving their SAMS email. And a couple of things I would point out, if you are in that group of people, number one, please check your spam folder in your email. Perhaps something got overlooked there. The other is to remember that it will take, even on when everything is going right, it'll take about 2 calendar days to get that email. If you have not received that email, however, feel free to call SAMS. They actually have a toll-free number. You can talk to a real live person. It's pretty amazing. I would also email them at samshelp@cdc.gov, and in the subject line, put something like urgent COVID module, something to bring attention to the email, so hopefully they will expedite your request. That being said, if you did receive the email from SAMS, it will contain a username and temporary password and a link to go and register with SAMS, which is, for COVID, is a relatively streamlined process if you're just getting into the module. It's hard to believe for some of you. I'm getting questions all the time. What do I do? What do I do? What do I do? I haven't received this. I haven't received this. Please be patient. They're overwhelmed as well, so they will get back to you. But registering for SAMS, we'll get back to it. The link will take you to the credentials page. You will have 2 different ones. As you can see, one has a big red X. Those are for the folks that's for the folks that have the full access. All you will need is to put in your username, your temporary password, and log in. And this will bring you to the 2-page form for SAMS. A couple of notes here. When you, as the administrator, are filling these forms out, use your personal home address. This is the purpose of this registration, is to do a cursory security check to make sure that you are who you are. So they will, part of that is tying your name to an address based on records that they can look at. So please be sure to use your personal home address, and then you will also be required to create your own password. And then there are a number of security questions and answers. And if you are like me and you have a really good memory, but it's really short sometimes, I would recommend writing down those questions and answers and putting them someplace secure. If in the future you have some login issues, that could save you some time. So now you've registered with SAMS and you've got your security all cleared and you're ready to go. You will log in at sams.cdc.gov and you will once again be brought to the credentials page. Please enter your username and the password you created. This will bring you to a page with these two links on it. Select the long-term care enrollment. Please select the desired option. You want to enroll your facility. The form is about a 2-page form. It's pretty basic. It should go pretty quick for you. On the second page, just a couple of notes. If you do again need to identify what type of facility you are, again, use those descriptors with the COVID-19 in the description. And the email address that you put on this form needs to be the same email that you used on your SAMS registration. I'm guessing that most of you will use your work emails, but just make sure that those two email addresses match. Now, once you've filled out the form, cross your fingers and think happy thoughts and click submit. And if all goes well, you will receive a message from NHSN to accept the agreement to participate and consent. And the message that you receive will have instructions on how to do that electronically. After you've accepted that, you have enrolled your facility successfully in NHSN. They will assign your facility an NHSN org ID. To put it simply, this is just a provider number that is unique to NHSN. It doesn't replace the CMS CCN number. It's just for NHSN purposes. So now you're enrolled and you're ready to start entering your data. So I'm going to just go back into my my website here, the CDC website. When you are entering data into the module, there are 4 pathways, and I'm just going to scroll up here. This is a nice little graphic up here that you have the resident impact and facility capacity pathway, the staff and personal impact, supplies and personal protective equipment, and ventilator capacity and supplies. And those are the 4 pathways. If I go down into my website, I've already gone through the enrollment. I'm scrolling down a little further, and I get to a section on data collection, forms, and instructions. This section here is for your data entry. There is a table of instructions. There are different instructions for each pathway, and I highly recommend that you keep this handy so that you can refer back to them. Some of the questions, I'm not a clinical person, but some of the questions, it's kind of a, well, did the person meet this? Did they meet this? And you kind of have to weed through some of that criteria before you can enter them correctly into the pathway. There's also this document, which is an actual data collection worksheet. This could be printed and downloaded and printed. And for those of you who are still waiting for your enrollment process to complete, one way this would be useful to you, I think, is to download these and print them off and start collecting your data to May 1st. And then, as soon as your enrollment completes, You've
I'm
got
sorry,
your
oh,
data
Lily,
all
what
gathered
happened,
up.
Lily?
Excuse me? I'm hearing somebody. Okay. But this would be very useful, I think, while you're waiting for your enrollment process. Maybe SAMS hasn't contacted you. Maybe you're waiting on something from NHSN. But you can go start to gather your data on these forms, and then as soon as you have access to your module, you're ready to go. If I go back to this website, and I scroll down a little farther, those of you who are like me, who maybe work in Excel a little bit, there's also these templates for each pathway. And these are just simple CSV/Excel templates. If it comes up here, did it open? Nope, let me try again. Okay. And it just downloads into the bottom left-hand corner of your screen, and you just open it, and there it's going. And let me just make that a little bigger. And it's just a very basic, bare bones template in Excel. This again would be useful if you are waiting for your enrollment, or if you are one of the facilities that just reports your date. You're currently reporting, but you're reporting once a week. Perhaps you could collect your data on these spreadsheets, save them to a folder in your on your computer, and at the time that you're ready to upload these sheets, there is a way to do that in the module, and it works pretty slick, really. So that's another option. So again, you've got the worksheet, and you've got the Excel formatted templates. With that being said, I think I'm going to try to get into Excel, or excuse me, into the module itself, and kind of show those of you who haven't seen the module what this is all about. So NHSN, and I have to say this before I start, my login procedures are going to be a little bit different than some of yours. Those of you who have access only to the module, I just have to go through a couple more steps is all. This is the SAMS grid card is what had the big red X on the enrollment form, and that's the one I have to use. So I will put in my credentials. And the password. And then I have to do another step here. And if I did it right, okay, now I'm getting ready to get into the NHSN application. And again, I have some of this might not look familiar to you. That's okay. And I'm getting a message that they're going to shut down tomorrow and do some maintenance. So that was helpful. So eventually you get to the long-term care facility component of NHSN. You will have the COVID-19 link right here. I'm going to go ahead and click that. And the first thing you see is a calendar where you can start to enter your data. Now I'm just going to go ahead and click in the 20th. Some of this stuff, I actually have access to a mocked up facility, so I can kind of play around with this a little bit, and that's why I can pretend to put data in the system. So if we click on the date in the calendar, you can see up at the top we have a tab for each of the 4 pathways. And they look a little bit familiar. If you recall, when I was on the website, the worksheet that you can print and copy looks very much like this. So if you are filling that out, waiting for your enrollment to finish, it should be pretty easy just to enter your data in once you have the enrollment. Right here, I'm on the resident impact and facility capacity. Here is the staff and personal impact. Here's the supplies and personal protective equipment. Here they're asking if you have, as of today, do you have enough masks? Yes, no. Do you have enough to last a whole week? Yes, no. Surgical mask, eye protection, gowns, etc. And then finally is the ventilator. Now, I realize that not all of your facilities have a ventilator, and if you answer no, you can bypass this pathway when you are entering data. So these are the 4 pathways. You enter your numbers, you enter your counts, and you save the document. When you save it and you go back to the, if you completed it properly, and we come back here to the calendar, it will show up green like it does here. If you did not finish the form, left something out, or maybe you had to stop entering data for a little bit and you have to come revisit, it will show up kind of this beige color. And that is indicated up here in the legend. For you Excel fans, if we scroll down a little bit farther, you remember the templates I showed you that you could download from the website. Well, you can download those right from the module as well. If I click in download the template, the CSV template, I can download all 4 of them at once, or just one or two of them. I click download. It only takes a couple seconds. It comes right down into the bottom left of my screen, and I open it, and here they all are, all 4 of them. So I can open the resident one, and I can enter my counts. I can save this to my computer until I decide to upload it. And, you know, again, if you're an Excel fan, that's right up your alley. When you are ready to upload your data, there is an upload button down here. We click the upload, and right here we can go into our computer. We can find where we saved those files, and we can click upload into the module, and there you have your numbers. Conversely, if your facility has a need to see the data that you've already entered, there's also an export option, and I can select, I'll just select the resident. I have one out here, I think, that has some kind of fake data, and this is down here. Again, it comes down in the left hand. I'll open it, and there you can see there's the data that this is all fake data, of course, but I was just kind of seeing how things worked, and so you can see that everything's duplicate, but at least you'd be able to see your data for each of the pathways. You could do some analysis, or, you know, just check to make sure that you're up to date, if that's your thing. So that is a very basic overview of the module in NHSN. And that's all I really have for my part of the presentation. I will say this in closing. One of the things I've learned over the last few weeks is that in talking with colleagues and teammates and fellow employees, is that none of us is an expert at this yet. So I really encourage what Mark started our presentation off with, is that we those of you who have questions that are listening in, I know that there are others out there that have the answer. So I hope that we can discuss and we can all learn from each other as the presentation goes on. So thank you for letting me speak with you today.
Great. I think Maggie, you wanted to share?
Can you see the document, Maggie?
Yeah, thanks, Mark.
Great.
Thanks, Ada and Tom.
Yeah.
Hi, everyone. It's really, really good to get to visit with you today. We know you're all working really hard, and we know you've been slammed with a gazillion things from CMS and CDC and all of your community partners. But I want you to know we're very proud of all the work that you're doing, and we're here to help you in any way that we can. And we do have resources available for you if you need us. So please, please, please get a hold of us. Tom already shared a bit about the reporting templates and the instructions on how to complete those. I think that's a good thing to have, especially if you're in an interim where you cannot get your data yet into NHSN, but it will be all in one place. One thing that I wanted to share, I found this accidentally, but you folks may already have it, but we wanted to make sure that you had it. And it's that CMS memo that went out to the state surveyors back on May 6th. And they talked about the reporting requirements for nursing homes that became effective May 8th. And we need you to look at those deadlines. And also, please note, there is an enforcement related question email. So if you have any questions or run into any problems regarding this CMS enforcement issue, there's a link right there that you can click on and hopefully get a timely response to your question. The other thing is all these resources have been put up on the ECHO website, and so you will have that available. And our website is also linked to the ECHO website too. But please take a note, May 17th, facilities must submit first set of data. Then they say they're going to give a 2-week grace period to begin reporting into NHSN system, which begins at 11:59 on May 24th. So that's your 2-week grace. Then if you fail to report after the 3rd week, you're going to get a nice letter from CMS saying that you need to begin reporting your data into the CDC NHSN website. And then I guess if by, where does it say, by the 4th week, if you've not reported, then that's when the penalties will begin, the fines. And so there is that memo that is out there, and it's also in the links for you to grab onto, and you can actually see that per CMS guidelines to the state surveyors. And they ask that you report weekly. You can report daily if you want, but you have to report at least once every 7 days. They want you to report, you pick a day, you pick a time, and that's the date and time that you report every day. So please be mindful of that. And let's see what else. I think that's about it. But we're hoping that you've all gotten in, or you're getting closer to getting in. We know time is marching on, and it's you had some short deadlines to get all this done, but we're here to help as best we can. So thank you for your effort and your perseverance.
And John, could you put up the last slide, please? And I see Maria Koslow said those deadlines are Eastern Standard Time.
Of course
Good.
we are.
Yeah. So do any of you need direct technical assistance with our last poll? Yes or no? And then John, if you could put up the last contact slide from the PowerPoint so everyone can see that information. And does anybody have anything we'd like to discuss at this time? One more. There you go. Thanks,
I think
John.
you guys, didn't you guys have a flyer that we actually, I think we posted on the website about, I think you have some Q&A sessions available coming up.
Yes, we are. They'll be on Mondays at 11 a.m. Hawaii time. We won't be meeting on Memorial Day, but the next 2 Mondays we will. Okay, so everybody's got this wired. They don't need any technical assistance. Okay. Good for you guys.
Great. Now, I just wanted to clarify, this is a requirement for nursing homes. What about for assisted living facilities as well? Or no? Because it says this module is for both nursing and assisted living facilities. Is it not required for assisted living facilities?
I think it's required for, well, they say long-term care facilities, assisted living, and SNF.
Okay.
Is my understanding.
Okay. So I guess we need to make sure that assisted living facilities are also on board with this.
Good.
Yeah, and I would be happy to check that just to make sure on that. I'll make a note of that. And
yeah, Patrick Harris, I was just wanted to check with you on that. Do you know if there's been talk about that at all amongst the assisted living facility community at HAH?
All right, so the NHSN reporting is optional for assisted living. It is not.
okay.
Yeah.
Okay, great.
Thank you.
Okay, that's good to be clear about that. Okay, great. All right, any other questions about reporting? If not, I'd like to just open this up to any other questions you might have that you would like us to address on these COVID series. I know that, let me give you a couple seconds. Okay, that's good. All right, I know that the last time we left off, there was this, I believe there was this memo about getting testing for all nursing homes. And that was a concern. And I just wanted to just kind of close the loop a little bit and say that it's still under discussion with DOH, and it is a huge undertaking, so it's not one to be taken lightly, and we don't want to rush into this, but just hoping that you should have gotten your PPE packages from FEMA as they sent it to all nursing facilities in order to enable folks to be able to do this point prevalence testing. That was sort of their intent. So, but we will let you know as soon as we know what kind of flexibility we have on that recommendation when we do know. But right now, we're not rushing into this. Patrick, do you have anything to add to that?
No, I think you covered it fairly comprehensively. It's discussions are ongoing. We understand it's a very frustrating situation for all parties involved. but state continues to work on this with collaboration from JABSOM, Hawaii, Healthcare Association of Hawaii, among other key stakeholders as well.
Mhm. So that's one of the things that we are addressing. Other things that we're kind of addressing in the background is, I know everybody's like wanting to open up. And we're trying to work on that as a future talk at some point coming up soon. Is it possible to open up assisted living facilities and nursing homes, and how to do it, and what degree, and how safe, and if at all? So these are issues that we will be tackling in upcoming sessions. Do we have, love to hear from folks about other potential topics you would like to hear from.
So Aida, this is Dan Saltman.
Oh, yes, yes.
Well, so I posted this article on, and I just wanted to make sure that people knew about this. I posted the reference for this article. So Atul Gawande, if you don't know him, is a brilliant surgeon in Massachusetts who is a very active thought leader and writer who sort of pioneered checklists, surgical checklists, and has written a book on death and dying. And he's the real thing. He's a real genius. And he's been making the media rounds recently, and I saw him, and then I read this article. And it has things in it that you know, but the clarity about it is so remarkable that it helps to see the way back from this pandemic. And it consists of 4 things which you know, so it'll seem obvious, but the details matter a little bit. It's hygiene, it's distancing, it is testing, and I'm going to come back to testing in a second, and it is the use of masks. And so the issue of testing and masks are very important. Masks are about protecting other people from you as an asymptomatic carrier. So it's not about protecting you from getting infected. It's about if you're an asymptomatic carrier, it protects everybody else. So there's sort of a 5th thing lurking in the background, and that was the culture of protection of each other in the community. And the issue of testing, it helped clarify in my mind the idea about the testing everyone versus testing only some people. And testing includes screening in this way. So symptomatic screening and temperature checking and testing for the virus itself in various ways. Certainly anybody with symptoms, I think we would all agree, they should be tested. And he sort of puts a threshold for that that's pretty low. So anybody with sort of any symptoms is a candidate for testing because they're potentially infected, and people who don't have any symptoms are also potentially infected. They should wear masks. So again, you know it, but the way he puts it out there and the clarity with which he understands what the issues are will, I think, impress people and will help you to see how we can go back to living a life that is more engaged, and at the same time mitigating the spread of a serious infectious disease that has a case mortality rate of at least probably around 1%, which is 10 times that of influenza virus. So you don't want to toss it off as if it didn't matter, because it's serious. Everybody's going to get infected, but there's a way to prevent the transmission. An important point that I want to finish with. The case that he makes for this idea and having it are the tens of thousands of healthcare workers that have gone back to work in serious facilities where they are exposed, and they have, by and large, prevented transmission by taking these kinds of measures.
Okay,
So,
thank you.
thank-
Oh, and just I also want to point out, yes, Naomi Kasuyanagi also just I'm sure everybody saw the CMS memo about nursing homes with the proposed 3 phases of reopening. But I mean, I've looked at that as well. That being said, you know, it's not a one size fits all, and it's probably needs to be discussed in much more granular details, right? It's the devil's in the details. So we can tackle that another time. I just want to apologize and kind of get back to Mark and Tom and our folks at Mountain Pacific. I sort of jumped the gun. Has anyone actually submitted their data into NHSN, and have they tried and has it worked? So I want to open it up to that.
Well, I know, this is Tom. I've looked out there, and I know that there are some Hawaii facilities that have had success, just because Mountain Pacific and some of those facilities belong to our group. So I have seen evidence of that. So that's really encouraging.
Okay, great. Look, Maria says yes, easy data entry. Christina
Yeah,
says yes, right? Okay, so that's 3 thumbs up.
Mm-hmm.
4 thumbs up, right? Actually, yeah, okay. Actually, does yes mean it's easy, or does yes mean it was just done? Okay. Yeah, so, okay, adding users is it possible to add users so you're not the only one doing it? Like, God forbid you get sick, right?
I believe you can. Usually when you have a person that signs up as the administrator for the group, you are allowed to add 1 or 2 users. And as a matter of fact, in general use of NHSN, it's actually recommended just for that reason, so that you do have multiple people that can log in. Those users will not have some of the access that the administrator does, but they will be able to enter data. They should be able to enter data and get into NHSN. So yeah, it would be a good idea to have at least 1 backup.
Okay, great. For some reason, the users you add need to go through a more rigorous identity verification process and notarize documents.
Yes, if you want access to all of NHSN, yeah, it's quite a process with the SAM system. They do require notarized ID, notarized documentation, and they do a pretty thorough investigation. It's called a level 3 security check, and for just the COVID module, it's a level 1. On that note, that brings up a good topic. I know there have been cases throughout this process that people have been trying to enroll, and they've been asked to submit these documents. And you know, from what I understand from a couple of colleagues, it's actually more common than it should be. And it seems to be a glitch on the NHSN side of the enrollment process. And it takes a little bit of time to get that untangled. So those of you who have not yet enrolled, if you're enrolling just for the COVID module and SAMS is requiring these documents, stop right there, because something went wrong. This for the module, you should get same day or within a day or 2 security clearance and access to enroll your facility. So yeah, thanks for bringing that up.
Okay. Any other experiences or issues that this is a good time to bring it up? Maybe Tom can go to bat for you over there. NHSN.
I will give a caveat, or just a little knowledge. I know that there have been people that have, when you have to contact NHSN if there's an issue, they only have an email. And it does take a bit of time before they can get to you. And what I've heard several instances within this process where the person that's having an issue will receive an email from NHSN where the ticket was closed. And NHSN actually fixed what was wrong, but didn't bother to tell the person that they fixed it. So the person thinks that their work ticket just got closed and they dropped it. And I'm just assuming that the NHSN is so overwhelmed right now that they're just going through fixing them and saying, okay, it's closed, instead of saying, okay, we took care of it and now we've closed it. So be aware of that. If you do receive an email from NHSN and it says ticket is closed, check and see if your issue was fixed before giving up. So, but they do take several days to get back to you, even when we're not in this type of situation. So don't be alarmed. It's not a fast-moving process, even though it's designed to be streamlined. It's coming into some hiccups, just like most things.
Okay. Great, but in any case, they can still fill out their data and keep a log of it
Yes.
on their phone until it's ready to.
Yes, and that would be a good idea. You know, if it comes to the deadline, and you can at least show that, hey, we're putting in the work here. We've got the data. We're just waiting to get our enrollment process finished. Who knows? Maybe they'll take note of that and give you a grace period to get that data actually into the system. So I'm not saying that will happen, but it certainly couldn't hurt.
Great. Okay, any other things people want to share? Okay, so I'm gonna go back to this issue here that Warren Wong raised, issues related to virtual encounters in nursing facilities. So I know we had a session several weeks back about telemedicine readiness in nursing facilities, and I'm kind of wondering if people feel there is a need to have another session about virtual encounters. Is it going smoothly? Do we need to share stories of how we could make this easier or more streamlined? Just throw it in the chat box or speak up, and maybe we can get a sense of where we might want to go with that. Are facilities doing telemedicine? Is it going well? Okay. I think everybody is shy. Oh, I have a new message here. Okay, telehealth. Okay, yeah, so Dr. Morita is using telehealth for the majority of her patient encounters, and this is in nursing facilities, I assume. I wonder if also for nursing homes and assisted living. Okay. Right. Well, Okay, well, if there is any needs for, revisiting this or thinking we could do this, sharing stories, making this better, we're happy to do that. Oh, okay, hospice at home, home care, long-term care, palliative care, all different settings. So it looks like it's working well with the facilities. That's great. That's great. I think Hawaii is doing a great job, it sounds like, so far.
Yeah.
We've really been blessed with this lull, so to speak, so that we can really put all of our systems in place and being proactive about everything. So, I just want to say I'm really happy about everybody here. Okay, let's see. Are the facilities okay about tele-encounters? So, yeah. Are facilities feeling okay about all that? Doing all the tele-encounters? Is it not taking up too much staff time, or is it, are they feeling resentful? Okay. From the doctor's perspective, seems okay. So I'm just kind of curious about the facility perspective. Yes. Okay. Good. Yes. Okay. Good. And so next week, actually, next Wednesday. Oh, let's see. We have had several telehealth appointments for our residents in assisted living and skilled nursing, and has gone very well. It makes it convenient for the resident and family too. Can't replace a face-to-face. That's true. Yeah, they severely limit visits, including from medical staff. Yes, that's true. Yeah, it really has actually made it easier for me to do family meetings, get people on board and things like that. That's what I've found. And then having the meetings with the residents, so that kind of has been working for me anyway. Okay, so just going to throw it out there next week. Next Wednesday, we're going to have Dr. Dan Hamowitz and Nurse Josh Allen going to be talking about more COVID challenges and opportunities in the assisted living center, which I think, can also carry over for nursing facilities and other long-term care settings. So I think that will be really helpful. And they will basically be sharing their experiences on the mainland, particularly Dan Hamowitz is in Pennsylvania, so that's where they're having a big surge at this time, and learning from them would be helpful. Okay. And before we close, just don't forget CMEs, do your registration, do your evaluation, and hopefully we'll see you again on next Wednesday, and then just keep letting us know in your evaluations any topics that you want us to cover, and we'll figure out how to have a great discussion. All right, thank you. Thank you, Mark, Tom, and Maggie for presenting.
You're welcome. Thank you very much.
Thank you.
And everybody, don't forget to look at the resources on our website. Thank you.
Thank you.
Take care.
Bye.